Ladies, joining me today is Dr. Kuldeep Singh, Director of the Maryland Bariatric Center at Mercy. Thank you so much for coming in. I know you're a busy guy.
Thank you for having me.
Yeah, and a lot of your patients that come to the Bariatric Center are dealing with type 2 diabetes, correct?
Correct.
Yeah, they go kind of hand in hand. This is a disease that's more prevalent, more deadly in the Black community. Let's take a look at some figures that we pulled from the Center for Disease Control, the CDC. Prevalence of diagnosed diabetes, about 12% of Blacks, about 7% of whites. You know, when it comes to death rates from diabetes per 100,000 people, 39% for Blacks, 19% for whites. Those are some big differences in those numbers. Why? What is going on there?
Well, it's not shocking. I think it is multifactorial. There are many, many factors. The genetics involved, there's access to care, there are social issues, the financial issues, the other health conditions which can occur like obesity and diabetes, blood pressure. Everything can gang up on a person when you have that kind of environment.
And how serious of a problem is type 2 diabetes? There's a lot that can happen to you if you have that.
Well, once somebody is diagnosed with type 2 diabetes, it's a disease that is relentlessly, progressively going to affect the human body. It will affect the blood vessels, which will eventually give you stroke, blindness, kidney failure, heart failure, loss of limb, extremities. So, and it is not only physically taking you down, it is taking you down from your employment and your productivity and wages lost. So it hurts you many ways.
Very
and it
serious
actually,
problem.
yeah, and it decreases your lifespan.
Yeah.
So it's not a easy problem to deal with.
Yeah, and the rate of complications, I understand, is also greater in the Black community. Is that having to do with access to care, do you think?
Partly it is related to poverty. Partly it is probably related to maybe some unknown genetic factors where the Black person is more associated with certain health conditions than others. But this difference between the races is stark. And it probably needs further studies.
Yeah, absolutely. And you wanted to make sure we talked about prediabetes, which a lot of people don't think about, and it's a huge problem.
Correct. So diabetes is when a blood sugar is a certain number or hemoglobin A1C is a certain number. And about 1 in 10 American adult has diabetes. When you talk about prediabetes, you're talking about 1 in every 3rd American adult has
1 in every 3rd.
1 in every 3rd. About 34–35%, no matter what population you study. The problem is it's just not, oh, it's a little bit high sugar, because it is associated with almost 2 times higher chances of dying compared to somebody who does not have prediabetes. And the better part of prediabetes is one can manage and dial it down and decrease the risk.
Right.
Diabetes is you cross the line. Although there are times we can actually, especially with bariatric surgery, we'll be able to roll back diabetes or its side effects or the complications.
Right.
But with prediabetes, it's much more reversible. You can actually catch it early and prevent
so many problems.
Correct.
Absolutely. Dr. Singh, thank you so much for
Well,
coming
thank
in.
you.
It's always great to see you.
Thanks for having me.
Yeah.